MitraClip is a new procedure helping heart patients across our region on a whole new level. As part of American Heart Health Month, we want to introduce you to the procedure at Mercy Health Lourdes that has helped patients transform their lives. Local 6's Pauline Fitzgerald joins us now in studio. And Pauline, is this the first of its kind in our region?
Yes, it is. Usually patients would have to drive a minimum of 2.5 hours to get this procedure done. But now they can do it right here at home. And even more importantly, it can be done without open heart surgery, which means recovery time is much quicker. So what is MitraClip? Well, it's a tool used to insert a clip inside the mitral valve in your heart to help it close more completely and to reduce any leaks that could be causing any shortness of breath or extreme fatigue. Dr. Abdelkader Al-Manfi tells me they're taking away some of the biggest barriers most of his patients face with this procedure.
MitraClip is the opposite. It's done from the groin. It's minimally invasive. Patient leaves the hospital next day. There is no sternal wound. There is no cut to the groin, and they go back to their life in a few days. So the recovery is so short. All of them, they go home instead of going to another facility for recovery, a nursing home or a skilled facility. So
Al-Manfi says mitral valve disease is one of the most common forms of heart valve disease. About 1 in every 10 Americans 75 and older have it. Coming up on Local 6 today, the symptoms you need to be aware about and what healthy habits you can implement into your lifestyle to prevent it.
It is 6:14. With most surgeries and procedures comes lengthy hospital stays, long drives, and sometimes having to be separated from the ones you love most.
As a part of American Heart Health Month, we want to tell you about MitraClip. It's a new procedure at Mercy Health Lourdes Hospital, and it's helping heart patients on a whole new level. And some of you may be wondering if this procedure involves open heart surgery. Well, the answer is no. It's actually a really simple procedure. Doctors get to the mitral valve in your heart with a thin tube, also called a catheter. That's guided through a vein in your leg to help you reach the heart. Then the MitraClip is put in close to the valve to help it close completely. The MitraClip is the first of its kind in our area, so for many patients, that means no more lengthy hospital stays. Dr. Abdelkader Al-Manfi says that he's treated fewer than a dozen patients with this new procedure, and all of them are grateful to be close to family.
That's a big burden on the patients and their families to travel for long distance to have this done. And some of them need to travel multiple times to be evaluated for various tests before the procedure and the actual procedure and follow-up. So really our patients appreciate that they have the option here to stay local and have the procedure done within their family and their home. So we're so glad to have that option for them.
Al-Manfi says many people may not experience symptoms for years, but if you do experience abnormal or irregular heartbeat, fatigue, shortness of breath, or especially if you've been active or even when you lie down, you should see a doctor. Try adding more whole foods to your diet along with exercising on a daily basis, and try to relieve that stress if you can. I know it's difficult. Coming up on Local 6 today, we'll introduce you to one of the first patients to get the MitraClip procedure done. She'll share how she went from not being able to walk to her own mailbox to now being able to do the things she loves.
You're watching WPSD Local 6.
We work so hard to take care of other people that we really need to pay attention to ourselves.
That's a lesson we could all learn from, and that's for Linda Stetson. She says her body started to tell her that she needed to slow down and start taking care of herself.
A little less than a year ago, after dealing with debilitating pain, doctors finally gave her some answers. She was diagnosed with pneumonia, went to the ICU, and suffered 2 heart attacks. As a part of American Heart Health Month, we're wanting to share stories just like Linda's for you to find your health answers. After finding out her mitral valve in her heart was no longer working properly, Linda was one of the first in the Local 6 area to get the MitraClip procedure done at Mercy Health Lourdes Hospital. One burden she didn't have to worry about was being away from her family.
We come from a small town in Missouri. We're farmers there. And to go see a doctor, we had to go to Memphis or to Cape Girardeau. And being able to have a doctor in Paducah, we're so blessed.
Dr. Abdelkader Al-Manfi is Linda's doctor and is the first to perform this procedure, helping many patients transform their lives. The procedure does not involve open heart surgery, but he tells me there are still some symptoms you need to watch out for, like abnormal or irregular heartbeat, fatigue, shortness of breath, especially if you've been very active or when you lie down. Those are all symptoms Linda once faced. She says it was hard for her to even get up and get to her own mailbox, but life is different for her now and she's able to do the things she loves.
After the surgery, it was just like I was reborn. It was a new life. It was being able to pick up the things that I like, get the material out, get down and cut it out, sit at the sewing machine for hours, get my canvases out, get my paintbrushes out, and like I say, keep thinking about spring. It was just, it's like a whole new life. If you've got persistent pain, go to the doctor. If you think it might be a heart condition, go to the cardiologist. They are more than welcome to see you. They want to help you.
Linda says she's excited for spring and be able to work in her yard, something she couldn't even dream of doing just a couple of months ago. You can find out more information about the mitral valve disease and the MitraClip procedure on our website on WPSDLocal6.com.